Hello, everyone, and welcome back to Bond Air. I'm your host, Jesse Longo, LVT, Associate Director of Nursing here at Bond. So excited. I'm trying to say excited less. I'm elated. I'm so pleased to be here. We have a really super awesome episode today as we continue to dive into the great field that we all reside in, veterinary medicine. With us today, Dr. Trina Hazzah, a highly respected veterinary oncologist who, after nearly 15 years of practicing medical oncology, shifted her focus to cannabis medicine for pets. Dr. Hazzah earned her DVM from Tuskegee University's School of Veterinary Medicine, completed a 3-year residency in medical oncology at the Veterinary Oncology and Hematology Center in Connecticut, and is also a certified veterinary Chinese herbalist. Over the past 8 years, Dr. Hazzah has treated hundreds of patients using cannabis, working to integrate this treatment into cancer care and improve the quality of life for pets. She's also the president and co-founder of the Veterinary Cannabis Society, the first U.S.-based nonprofit organization dedicated to building awareness around cannabis as medicine for pets. Through her work, Dr. Hazzah is helping to educate veterinarians and pet owners alike on the safe and effective use of cannabis in veterinary care. Today, we're going to dive into her journey, discuss the potentials of cannabis medicine in treating pet cancers, and explore the future of this rapidly growing field. So without further ado, hello, Trina. How are you doing?
Good, good. Thank you for having me, Jesse.
Thanks for being on. I'm, like I said, super pleased to have you here. I think what you do and what you have been pioneering over the last almost decade at this point, is really impressive stuff. And I would love to kind of hear what your journey's been like, because that's a huge transition into, for our field, kind of uncharted waters for sure. So I'm sure that was a little bit, daunting, but you really have done so much.
Yeah, no, it's been a blast, actually. It's been more exciting and more, I would say it's been more of a fun adventure than a scary adventure.
That's always good. Um, awesome. Yeah, I think how has cannabis kind of like changed the way you practice? I think that's like one of the first questions that kind of comes to mind for me.
Oh, God, drastically. I mean, what's so interesting, I think, about cannabis, it's this plant that has over 700 compounds. And many of those compounds have like profound medicinal and pharmacologic effect. So it changes how I practice medicine in such a major way because now I have this new tool that can be really helpful to a lot of different disease processes that we see in our veterinary patients. And there's a good amount of research too that I use to support it. I don't, I'm a big fan of practicing evidence-based medicine. Started off as very conventional and slowly started to go down more of the integrative approach and really using things like cannabis and Chinese herbs, but really using the science behind them as to how it can add to the medical benefits of, say, some of the conventional therapies, or folks that are not interested in going the conventional route, knowing that there is another option for those pet parents, really, I think, gives them hope that means if they don't want to, say, do chemo, or they don't want to do an anticonvulsant, or they don't want to do Prozac for anxiety in their pet, that there's another option. And cannabis has now been shown for a variety of different conditions to be effective in veterinary medicine. And that includes, just from a publication standpoint, I would say anticonvulsant,
Hmm.
anti-anxiety stress, for sure anti-inflammatory, specifically for OA, analgesic for pain conditions, post-op pain, as well as, oral pain, some of the atopy, some of the inflammatory skin conditions, cancer, in more of a definitive setting. But we see that's based off of some in vitro canine cell culture studies, but really some very interesting information on the palliative effect. I actually just published a case report a few months ago on the use of cannabis for a cat with advanced cancer, and how effective it was for a palliative approach for that cat.
Oh wow. What were like kind of like, if you could summarize, I'll link that study into the description, because I'm sure a lot of our vets would want to hear it. But what were kind of some of the big standout aha moments from that for you?
I mean, it was a cat that was lateral recumbent with a mass. It was a thoracic mass taking up um, almost like 80–90% of the
Ooh.
thorax. And the cat wasn't really even able, had severe exercise intolerance and wouldn't eat very well. And I mean, couldn't hardly breathe, had to be sedated just to take radiographs to find out what it had because it was so, it had such labored breathing and the stress just made it even worse. Um, and like owner didn't want to do anything more. And we, from a conventional standpoint, no chemo, no radiation, nothing like that. So went right into using cannabis and it was like a reversal. I mean, it was kind of crazy. Like, I think the doctor in me is like, I don't know if I believe it until I see it. I'm like,
Mm-hmm.
let me, and then I see it and I'm like, holy wow, look at that. But like, to see this cat go from lateral recumbent, not able to walk very well or even around the house, play with his fellow, animals in the house. There's a dog that was like his homie and they hung out all the time. And the cat started to eat, had the munchies, like it actually gave appetite
Yeah,
stimulation. And then started running up and down the stairs and playing with the dog and lived for 6 months in like better quality of life than it had before it was even diagnosed with the cancer.
that's
Like,
incredible.
so that a few take home is it drastically changed the pet's quality of life.
Mm-hmm.
The other take home would be this formula was really made specifically for that cat. The idea of a personalized medical approach with cannabis is really where I think cannabis will likely be. Like you can't just do a one size fits all. And this particular cat had a product with CBD, THC, and some other cannabinoids and specific terpenes that also you work to help open up bronchioles. And so you could see how well that worked for the cat because it started breathing much better.
Is that like specifically compounded then that you have a pharmacy that does that for you?
It's a manufacturer, like a company that's nearby that actually like custom makes products. Being in Los Angeles area,
I was gonna say
it's like,
you're based in California, so yeah, you have
yeah,
access to a lot
if you're
out
gonna
there.
find a place that does custom cannabis for pets, it's gonna be in California most likely. So I lucked out in that way. But honestly, like I am lucky, and we'll talk a little bit about this in a little bit, but I'm lucky enough to help people all over the world. And sometimes they don't, I mean, 99.9% of the times, no one has custom. So we
Mm-hmm.
create a custom for that patient in a way by combining multiple products.
Well, that's an incredible story, and I think that like what was the journey of like kind of realizing the power and effects of cannabis on your patients? Like what was kind of like those early moments for you that kind of transitioned you over? I know you kind of obviously with having your herbalist license and things like that, that probably kind of started to spark it. But yeah, I would love to hear from you.
Totally. Yeah, yeah. No, I think what it was for me was starting to see where there was a limit to what I was able to do from the conventional side. Like I always stop. I couldn't go beyond it. And then I started to use herbs and I was like, oh my God, this actually, the dog or the cat or whatever is eating. I'm actually fixing this deficiency. This dog or cat had a blood or a Chi deficiency. I'm fixing that. And now the cat's running around like a kitten, or now it has more energy. Now it, is feeling so much better. They're undergoing their conventional therapies in a way with a way better quality of life than they were before, or they're living twice as long as they were before I was adding in some of these other integrative modalities. And then cannabis just kind of fell right in. I was learning about herbs and then found out about cannabis. And what I think got me on cannabis, which some of the herbs don't have to the same level, is the amount of research. Like
Mm-hmm.
I'm research based. I really believe in the importance of using evidence to help kind of guide us as practitioners. And so when you look at that research, it's incredible. I mean, even if you just looked at the anti-tumor effect of cannabis, there's over 100 publications just for CBD and THC, not even the other cannabinoids, and a ton for some of these other conditions as well. So it's fun to then take some of these studies and then incorporate them in animals if they haven't already been done clinically in animals.
Yeah, I think that I mean that the research alone, I agree, it's something that is like especially over the last like couple decades has been so vast. I also think about kind of the other regulatory landscape that you kind of encountered in starting this practice, and like you mentioned, we'll talk about Green Nile in a second, but I'd love to hear kind of the challenges that you started to face, and I know that you've been kind of active in policy a little bit with this as well, because I think you kind of have to be, especially in the vet industry as an LVT. You know, like we have a lot of campaigning that we do for our population, but I'm sure, 8 years ago when you kind of jumped into this, even, I mean, from a human standpoint, it's different. From a veterinary, I can imagine it's even more. So, yeah, I would love to hear kind of like how you navigated that.
Yeah, that's a great question. And that's the real deal. How do you actually start doing it in an environment where it's not acceptable? Or even worse than that, it's prohibited,
Yeah.
right?
Yeah.
So, I think part of it, thank goodness, is the personality that I
Mm-hmm.
have. I think that's helped me a little bit where I'm like, you just kind of go rogue sometimes and hope for the best. Um, but also I think I had this strong belief that it's like I do believe in do no harm. And as long as I understood that what were the contraindications, the safety parameters, then it was really almost, I mean, almost all of the cases, like if I'm not getting improvement, there's rare, like I might have a side effect, like they get a little intoxicated from the THC, but it's so short-lived.
Mm-hmm.
Almost all these cases, if they're not getting improvement, we just change the product to find something else that is. It's rare we have side effects. And when they are noted, we can just switch them and it's quick. It's not like it's a sustained thing. So talking to the veterinary medical board about that in detail and saying like, my hands are tied. They're coming and asking.
Mm-hmm.
I can't not talk about it. I feel like I'm doing a disservice, not just to the patient, but to the pet parent. And then they're stuck going to the local dispensary, which you guys have in New York too, where these pet parents are like going to the person that just graduated from high school, never went to veterinary school or tech school,
Mm-hmm.
does not understand animal physiology in any way. And then they're saying, I use this for my grandma, maybe try it for your cat. And they don't realize that it's super contraindicated for some reason, or there's an inactive ingredient like xylitol or something
Mm-hmm.
that could be problematic. And that was a lot of the conversation. And then actually going from an really what I would consider more of an adversary, like we were like fighting against the board nonstop for a period of time. And that's where the Veterinary Cannabis Society did actually develop, because we had a lot of advocacy effort and we were like, we got to get other vets supported and things like that as well, and start a nonprofit. And I can talk about it in a little bit. But we went from that place of being more of an adversary to actually working as a team with them. Like
Mm-hmm.
it became really sweet. It was like, hey guys, listen, I'm not here to sell drugs in the alley behind the hospital. Like, I don't want to sell anything. I've never sold any sort of products. People always ask, well, why don't you just do your own line? And I'm like, maybe there's a time for that, but right now it's going to be hard to stand in that
Mm-hmm.
and be selling my own things and looking like it's just for personal gain. And so it's so much more than that. And being able to really provide critical information that these vets that are on the board and the other board members just don't have the time to learn about. So once you get them involved and they now are understanding, it's really difficult to look away from it and say like, this isn't needed. So really the education piece is huge as well. And really kind of looking to work together with the veterinary medical board and support them in learning more so then they can support the right bills the right way.
I love that. I love basing, basing your argument in the education piece, and making sure that folks know what it is you're advocating for and why it is you're advocating for is really, that's a huge takeaway, I think, for trying to convince those of what you're fighting for is worth fighting for. So I think that like is a great transition into talking about Green Nile, and a bit about how you've used this platform through like telemedicine and informing both patients and other clinicians of how cannabis can be integrated into treatment plans and such. So I'd love to hear a little bit about how Green Nile works and what your experience has been so far with that.
Yeah, I'd love to share. So with Green Nile, it's a company that I created back in 2019, and I was working at a large corporate hospital and started to get just burned out like a lot of us do, and I wasn't able to do all of the I was kind of unfortunately kind of stuck in this role of also still practicing more conventional, which I wasn't as excited about. I started to get way more involved in the cannabis and more excited about it. I mean, I would be like super excited to go to work and see those cannabis cases and not as much just the other, regular oncology cases. And I just listened to my soul and it was like, well, why don't you do what you want to do? Like you, at the end of the day, you are happy when you get to help and support pet parents. But here's the reality is like, yes, I'm happy, but there's something that happens within me that made me not just become a general vet. Like I don't have the brain. I don't have the brain capacity to do what a GP does. Like
Mm-hmm.
their brains have to know just like everything about everything, like details. Like I have to know about this disease, and there's no way I don't have the brain capacity for that. I was like, I just have to know about cancer. I can do that.
That's it.
Become an
Yeah.
oncologist.
Yeah.
And then like I just don't like I think GPs are wonders. Like I don't know how they can keep it all in their heads. And then I went from that to saying I can just do integrative oncology. Now it's like I can just do cannabis medicine. Like clearly the idea of going into one thing and going down a rabbit hole for like part of my life
Mm-hmm.
is what my jam is. Like I clearly enjoy that. And so it was really just listening to my soul and kind of being very honest with myself about what are the things that make me happy and why this would make me happy and what my values were, right? And really kind of sticking to those when I make my decisions. So it was like, how lucky am I to be able to practice cannabis medicine and be able to help people all over the world? Because I don't really do telehealth except for the folks in California. I do something called teleconferencing, which is legally different in that I can't make a diagnosis.
Right. Yeah.
I mean, Jesse, you know a little bit about that. Like I can't make a diagnosis. I can't prescribe. I actually don't make like formal recommendations,
Mm-hmm.
but I will go through whatever the disease is that the pet parent is talking about. Sometimes I get medical records that I can review and talk to them a little bit about the process, the publications, contraindications. This is all just educational information. And I'm very careful about how that goes. And then I guide them to product selection and how to pick a safe product, how to dose a safe product, or how to dose a product, how to look to make sure there's not contaminants in products and things like that. Like I get the joy and the honor of being able to do that. And I get to do it from people all over the world. I get to work for some companies every once in a while and do some, contracting work and make products, which gets the creative side of me to come out. So I get to make products or work on research and, work on certain, clinical trial designs, which is really fun because I'm using my mind in all different ways, but still very much on the cannabis front. And then I do some integrative oncology work still because oncology has, been my passion for a very long time, and it's hard for that just to disappear. I
Of
still enjoy
course.
it. I still like helping on that level as well. So Green Nile exists because I just thought it needs to, and it's really enjoyable to be able to do it. I hired one other vet who works with me sometimes. She's got many other things going on, but super smart, integrated practitioner as well. And so she does a few cannabis consults, but I'd say I do probably most of them as I make time and make space for it because I learn and I enjoy all of them as well. And I love to see the impact of them getting them on the right product and what's happening. And honestly, I think hearing about people hear about Green Owl, honestly, most of it is through word of mouth or having the conversation like this, saying, Jesse, let me just send you some flyers
Mm-hmm.
or some postcards so you can start giving it out to clients. It has been zero marketing from any other standpoint, which is kind of cool in a way. Maybe I'm clearly not a business person, so I'll just put that out there. But the cool part of it is a lot of the clientele I get are like, hey, I heard about you. And there's like a connection that we have from someone, or
Mm-hmm.
like Lisa that was sweet enough to introduce us. Like that connection makes it even more special a lot of the times. And so, one of your bond vets might be like, hey, I heard about Trina, and the owner then feels a little bit more confident that there's that connection versus them. Some people just find me online for sure,
Mm-hmm.
but it's not because of my grand marketing that's happening. It's just the universe that's setting that into play.
Absolutely. I mean, before we went live, we were discussing one of our own dental VTS is Sheena Davis, a member of the VCS and a cannabis counselor as well. So it's definitely, the vet industry is small, but like that universal connection is always so great to see, and especially for like you said, like getting the word out to clients and vets alike to understanding, especially when us feeling on the polar opposite end on the East Coast of like not feeling even access to that kind of care or how we're thinking about it, kind of shortening that, making that map a little bit smaller so we can share a bit in that.
I love it.
Yeah, I love it too. As we kind of I wrap up here, I do have a couple of questions from our team in a new segment. So it does have
Yes.
some fun music. I'm going to put up for a second. We have Clinic Conversations, where we asked our clinic team members what questions they have for the guests on Bond Air, what's on top of their minds as they think about these topics. And I'm really excited because we have some cool questions coming in that a little bit we touched on, and some that like obviously are still prevalent for our clinicians of what it is cannabis care can be used for. One of the first things that you kind of mentioned, and it is a question that I thought about too, and it's around dosaging and things like that. But do you ever feel like, and obviously in an unregulated space it's harder, but one of our vets asked, is there ever kind of like major concern for you of like potential overdose? Because I worked in an ER for many years, and we've seen plenty of dogs that got into the stash and came in, dribbling urine and a little bit ataxic, and obviously to new vets. I think the first thing they think of when they think of cannabis medicine is that dog, right? So I guess how do you think about the dosaging and I mean for the access that you have to compounding pharmacies and things like that, obviously change it a bit. But as you think about this and other practitioners get into cannabis, how do you kind of think about the potential for that?
Yeah, yeah. Well, I think it's very unlikely when the pet parent has some sort of guidance,
Mm-hmm.
right? Like if you have an idea of, you know, oftentimes what I do during my consultations is we talk about which products sometimes they have products already at the house. We review a certificate of analysis, which is essentially a lab report on that particular product and batch number that matches the batch. So we know exactly how many milligrams of THC is in that product, and other cannabinoids, of course, but we're specifically talking about intoxication here. So THC would be probably the big issue, or even Delta 8 and Delta
Mm-hmm.
10 and some of those other kind of other THC molecules. But when you know how many milligrams exist, it's very unlikely you get an overdose because they dose as you request. Every once in a while, and it's not happened to me, thank God, in the years I've done this, but I have heard where an owner, like from companies, where an owner will say, by mistake, give their little dog the big dog's dose or something
Mm-hmm.
like
Yeah.
that. And then if they get intoxicated, they usually just write it out. I've never had any cases where they've had to take them to a hospital or do any
Mm-hmm.
of that because they're getting guided. It's not what happens without the veterinary guidance or without a knowledgeable person's guidance is they go to the dispensary or they go just try something of their own. They're like, I gave a part of my gummy and they don't know. And so
Yeah.
that's where the problems lie. But having a company like Green Nile and other practitioners out there in the world that are supporting pet parents, it's so unlikely to happen because you're getting the support.
Absolutely. I think of my time in community clinics and other kind of like ER settings where folks, not even cannabis, when we think of like, oh, we give our pets NSAIDs and it's like, oh, I gave them, Advil, Tylenol, and you're like, well, I take it myself. Why wouldn't my pet be able to take it? It's the same kind of idea. Without that instruction, that expert guidance, it leaves clients really in the lurch and potentially putting their pet at risk in that way. And final one, I think it's a good one to end things on. Do we, or Trina, do you ever see kind of like society or, mainstream leaning more towards kind of like alternative or herbal medicine as part of that new standard of care rather than just like kind of outside of the box or alternative to begin with? Do you see that on the horizon with kind of how you?
Oh, for
Yeah.
sure. I mean, the owners are we are being guided by the pet parents. And let's be real, like a lot of people out there now are looking for holistic means themselves.
Yeah.
They're looking to start supplements and herbs, and a lot of people, I mean, a lot of people, and it's not even age restricted at this point, that are looking to use cannabis for their own anxiety. The world is
Mm-hmm.
full of anxious people because the world is different and it continues to change. And it continues to create a lot of anxious people, unfortunately. And so I think a lot of people are using cannabis and you know, even something like, psychedelic medicine, microdosing now is kind of the new thing. It's like, the people that are like, funny, the retired people are now talking like, hey, have you started to microdose? Are you taking your gummy at night before bed? Like,
Yeah. Yeah.
it's not looked upon anymore as this, I'm embarrassed to
S-
tell people I'm
Stigmatized.
doing it.
Yeah.
It's not stigmatized anymore. It doesn't seem to be to the level. I'm sure there's
Mm.
some, but in places that are big cities, people are open. They're proud that they're not using an SSRI, but instead they're using something natural, right? Like,
Yeah.
and that was not the case. People kept a lot of that stuff secret before. So I think that the veterinary profession is going to follow suit because it has to. People are going to be asking for it more and more and more. And vets are going to have to be educated, or they're just going to say, there'll be many veterinary practitioners out there that are doing cannabis and other types of, alternative medicine where, you know, this thought of every vet then should be an expert at that is ridiculous. It'd be like saying, Trina, you need to be an expert at treating skin disease and eye disease, and like that's not who I am. So I get to then send them to their regular vet who may do that really well, or a specialist. So I think just like, holistic medicine or cannabis or one day psychedelic medicine, whatever it will end up being, there will be specialists or more experts in that field. If there's not necessarily a college of specialization, but there's more experts in the field where people can feel more comfortable saying, look, it's not my thing, but I know there's some really interesting research I heard about. Go talk to the person that does it.
Mm-hmm.
And then it becomes this awesome community where you don't have to trust me to know the stuff I don't know, and I don't have to feel bad about not knowing it because there's other people out there that know it. And I think that's working as a community in a much, much stronger way.
Exactly. That is something we have a group of area lead nurses in our organization, and what I tell them is always like, none of us expect you to be experts in everything. You all have your own passion points. You all have, the journey that brought you to where you are, and your own kind of niche of what you research, and using, like, I literally call them, you have a community of each other. So I think that
Yeah.
as you continue to grow, and as like the field continues to grow and expand in our perspectives and in how we practice, that's going to continue to be the case. Well, that is a perfect way, I think, for us to conclude today. But Trina, thank you so much for being on. I really appreciate it. I really loved this conversation. I know our teams are going to absolutely love hearing it, and the listeners as well. Where can the folks find you?
Oh, yeah. Feel free to visit my website at greennile.org. You can find me there. There's a contact me if you have any questions. I'm delighted to help. And anyone that's interested in just learning more about cannabis, you can also go to the Veterinary Cannabis Society website at vcs.com.
Awesome. Well, thank you again so much, Trina. We'll hopefully talk to you soon. And for the listeners, thank you so much for tuning in, and we'll see you later.
Have a